afternoon. The past few weeks have been very, very difficult for all of us. It's heartbreaking to hear the tragic stories of suffering and loss. This terrible virus is a ruthless killer, and we're all at risk. But the sad truth is, this virus preys on the most vulnerable. It preys on the defenseless, and it's the most vulnerable, those who cannot look after themselves, who are at the highest risk right now. And for our most vulnerable, for our seniors, our parents, our grandparents, how far we go, how hard we fight, will mean the difference between life and death. And we owe it to them. We owe it to those who cannot defend themselves to do everything in our power. Yesterday, we announced our action plan to protect our long-term care homes from COVID-19. These homes are turning into the front lines of this battle. And yesterday, we sent in the cavalry. Medical SWAT teams are being deployed to long-term care homes who need it most. We're bringing in the very, very best specialists who are trained in the detection, prevention, and containment of the world's most deadliest diseases. These people understand better than anyone in our system how viruses like COVID-19 work. And they know how to stop this virus dead in its tracks. I've said it before, the dedication and commitment of our long-term care home staff is incredible, truly incredible. They continue to put the needs of the community ahead of themselves, but they need our support. And I want them to know more help is on the way. I said we would do absolutely everything in our power to fight this virus. And after weeks of preparation and hard work by hospital staff and our frontline heroes, we've added over 2,000 acute care and critical care beds to our hospital system since the start of this outbreak. And we're on track to add another 4,200 acute care beds by the end of April. It's because of these efforts that we're able to redeploy resources to our long-term care homes and other priority areas. And last week, I promised by today we'd be testing 8,000 people a day. Well, today we're at over 9,000 COVID-19 tests. We've hit our first target, and we're going to keep ramping up our efforts until we hit 14,000 tests a day by the end of this month. We'll continue to expand testing more people and priority groups. We've expanded our testing guidelines. We're making sure we're testing the people who need our support the most. We'll be testing at homeless shelters and women's shelters, homes for people with disabilities. We'll be testing women who are pregnant and newborns, people who are undergoing chemotherapy, dialysis, or requiring transplants, because my top priority is making sure no one in this province is left behind. Folks, this situation is unprecedented, and I can promise you, we're working around the clock to find solutions to the problems we as a province have never faced before. We've started by working directly with our partners on the ground, municipalities, charities, and shelters, to make sure they have the resources to keep their staff and residents safe. And in the coming days, we'll provide more detail in the next phase of our plan to further support these communities. The challenges we're facing from COVID-19 impact every person in this province. If it's a financial impact, mental impact, physical impact, we will be there to support you. Let me finish by saying this. I know that each and every family that have lost a loved one is grieving right now. And I grieve with you. I know that people are worried about their next paycheck. And I worry with you. I know that people are anxious staying in their homes, and I share that anxiety with you. And that's exactly why I'm working around the clock. That is why my staff is working around the clock, and that is why the Ontario Public Service is working around the clock. We won't stop working for each and every one of you. Thank you, and God bless the people of Ontario. Thank you. I'll pass it over to Minister Elliott.
Thank you, Premier, and good afternoon. From the beginning of the outbreak of COVID-19, we've been firm that the health and well-being of our people must be our #1 priority. We've been hard at work planning for every contingency, planning to respond to any scenario. To truly honor our commitment to safeguard the health of Ontarians, we have at all times operated under the assumption that the worst will occur and have planned accordingly. We have taken nothing for granted, including working with Ontario's hospitals to create unprecedented capacity at remarkable speed. Because of these efforts, Ontario has added more than 1,000 acute care beds, with the potential for an additional 4,200 beds by April 30th. The total number of acute care beds now stands at well over 20,000. There are now 3,500 critical care beds in our hospitals, nearly 1,500 more than when the outbreak started. Of these beds, more than 2,800 are now equipped with life-saving ventilators, up from 1,300 just a few short weeks ago. These considerable efforts have been organized in coordination with pandemic staffing plans to ensure that each hospital has the physicians and staff needed in case of a major surge of cases. As part of this expansion, we are redeploying surgical nursing staff who can now work with medical units, sharing highly trained emergency department and intensive care unit nursing staff across units, sharing physician resources across hospitals in a given region, recruiting family doctors to complete shifts within the hospital, and recruiting retirees, including nursing and support services personnel. All told, we are prepared to respond to a surge in cases should it occur. We are ready to protect the health and well-being of Ontarians. Before I conclude, allow me this opportunity to thank our partners on the front lines, the Ontario Hospital Association, the experts at the COVID-19 command table, and the leadership of Ontario Health for helping to build this new capacity. Long before any of us had heard of COVID-19, our government launched an ambitious project to break down the long-standing barriers that have for decades now locked the expertise of Ontario's world-class health agencies away in silos. That project culminated in the creation of Ontario Health, a new agency that brings together the combined knowledge, strengths, and experience of up to 20 existing health agencies and the many talents of their highly skilled staff into one integrated organization. In doing so, Ontario's healthcare system has benefited immensely, as Ontario Health has demonstrated a degree of responsiveness and shared purpose not previously imaginable. Indeed, looking at the significant capacity created in our hospitals in such a short period of time, it's clear that we have all benefited. Thank you.
We talk a lot about heroes during this pandemic. There are many heroes in communities across Ontario. These everyday heroes go above and beyond every single day, no matter what. And there's a special type of hero that I want to recognize today. They're superheroes, in my opinion. These heroes are known as personal support workers, or PSWs. To all the personal support workers, I'm speaking directly to you from the bottom of my heart. Thank you. When I speak to people about long-term care in Ontario, the one thing they all have in common is stories about a personal support worker that impacted the life of their loved one in a big way. And I have those stories too. And as we continue our efforts against COVID-19, we are seeing how this virus is unfolding in a vicious way across the world. Long-term care homes around the globe are on the front lines. And yesterday, we launched our COVID-19 action plan for protecting long-term care homes. And today, I want to provide you with an update. In the last 24 hours, we have seen 5 hospitals in Toronto band together to support 38 long-term care homes. This is the model that we will be expanding across this province. Issued guidance to hospitals to temporarily stop the transfer of patients to long-term care homes, and worked with public health to complete risk assessments for all 626 long-term care homes to ensure that resources are most effectively deployed, and issued new guidance to long-term care homes and retirement homes on usage of masks, updated guidance documents regarding new long-term care home testing strategy and outbreaks in long-term care homes to reflect our new action plan and emergency order, building on our previous efforts. And we will continue to take decisive action in our efforts against COVID-19 in our long-term care homes across Ontario. Everything is on the table, and we will spare no expense to keep our most vulnerable people in long-term care safe.
We'll go to questions. First question.
First question comes from Lisa Shing from CBC. Please go ahead.
Hi there, Premier and Ministers. On long-term care workers only working in one home, that order starts in 1 week, April 22nd, and the measure will only last for 2 weeks. And we're also learning temporary workers are still able to work between different homes. Now, if we look at, say, British Columbia, it stopped workers working between homes much earlier by paying all of them full-time wages. And their emergency measures last for the duration of the COVID pandemic. So why aren't we going further to get this right?
So we started this through the recommendation from the Chief Medical Officer of Health 4 weeks ago. It was strongly recommended. We wanted to take additional measures and make sure that there was providing even more safety for our long-term care home residents, and that is why the emergency order has been declared. For the staff in the long-term care homes and the operators of the long-term care homes need time to adjust to this. Some employees will have to choose. If they're not already working in one home only, they will have to choose, and they need time to give their employers their decision, and for also the employers to be able to have enough staff. And that's why this was put together with the staffing strategy as well, in terms of workers coming from the home care sector or hospitals and the other supports we've put in. In terms of the agency workers, we know that many homes have been struggling before this pandemic came to be in terms of staff. And that's what our ministry, the Ministry of Long-Term Care, was working very hard to resolve that issue when this pandemic broke. So in the context of a pandemic where staff may have to self-isolate, we needed a group that could be able to provide the safety for our residents in long-term care through shoring up the capacity of staffing. And that's why the agency workers were not included. They will, and I should add that they must adhere to strict and rigorous screening. That has to be across the board. But this was allowed our long-term care homes to be able to maintain the staffing that's necessary, particularly right now.
Thanks very much. And my follow-up more generally is the fact that we're now seeing outbreaks in more than 100 long-term care homes. Mm-hmm. So why did measures we implemented weeks ago, like screening, fail to stop those infections right at the door?
Yes, and that's exactly what our Chief Medical Officer of Health and Public Health is looking at with our targeted screening in select homes to understand how elusive this COVID-19 is and what else we can do, what other tools we have for this. Obviously, it's testing, but it is asymptomatic spread, and this has never been seen before. COVID-19 is a new type of virus. Typically, pandemics are influenza, but in this case, it's a new virus with a new way of spreading. And this is a global phenomenon in long-term care. Across Canada, high rates of mortality amongst the over 80-year-old groups to begin with, and whether that's in the community or long-term care homes. But this is a global phenomenon, highly impacting our long-term care residents and homes. It's tragic and it's unprecedented. And we rely on the advice and recommendations and directives of the Chief Medical Officer of Health, the best minds responsible for the scientific evidence and medical evidence that we have.
Next question.
Next question comes from Cynthia Mulligan from City News. Please go ahead.
Hello, Premier. My question is for you today. It's been almost 2 weeks since you released those modeling numbers with best worst case scenarios, and things have shifted. We're seeing like a 6%. We're hovering around a 6% increase in cases every day. We didn't hit those catastrophic ICU numbers. When are we going to get the new modeling, and where do you see us overall in this battle when it comes to the curve?
Well, Cynthia, I give all the credit to the 14.5 million people in Ontario that practice social distancing, self-isolation. That's the reason we're in a relatively half-decent, I'm not even going to say the word good, because we aren't. This could come back and bite us in the backside in about 10 seconds. So we have to be very cautious moving forward. On more modeling, what I understand, and I will confirm it, we're going to be gathering more numbers this week, and hopefully sometime next week they'll have some more modeling. But I'd like to confirm that first with the command table.
Okay, thank you.
Thank you.
And my second question is, and this was raised by my colleague Faiza with you last Friday, the province is not collecting race-based data on people, on the numbers being impacted by COVID-19, nor is the province collecting data per postal code. And my question is why? Shouldn't we be looking out to see if the vulnerable communities are being more heavily impacted? And there are greater calls for collection of race-based data. Would you consider doing that, and why aren't you doing that?
Well, not so much race-based, but we are looking at regions, so it automatically is area codes that we see the hot spots until we can redeploy our resources, no matter if they're health resources or just simply communication. But we do have a map that shows us where some of the hot spots are throughout the province, and we're redeploying the resources needed in those areas, but also communication, making sure that if we see a tremendous amount of cases in one area, we have to pick up the communication to make sure that people are self-isolating and practicing social distancing. So we do have a map, and we can see where the hot spots are, we can see what area code they're in, and we can redeploy the resources that they're needed.
Next question.
Next question comes from James Moore from Newstalk 1010. Please go ahead.
Hi, good afternoon, Mr. Premier. Could you just talk about what you are going to do to supplement the rent relief program that was announced for businesses by the Prime Minister?
So we're going to be on a conversation with the premiers and the Prime Minister this afternoon. We're also going to bring this discussion to the Cabinet table after that meeting and see how we can support these folks there. We do need the support of the federal government, as I mentioned yesterday, and we'll see what they bring to the table. But I think they definitely need some support, both the businesses and landlords.
And, I know it's early, but can you give us any insight into whether schools are going to go back to being status quo when school eventually starts up again? Like, would the expectation be that fewer students would be in the classroom at a time?
Well, I think that's a little premature right now, James, but let's see what the minister rolls out over the next little while and base it on that, and base it on definitely what the Chief Medical Officer has to say.
Next question.
Next question comes from Christina Tenaglia from CP24. Please go ahead.
Hi,
Hi, Christina.
Hi, ministers. I wanted to ask you about the change in the way that testing data has been reported. Premier, you referred today that the quota had been met in terms of number of tests, but you also talked about testing people.
That's right.
From what we understand, previously, the numbers that were provided on the Ontario government's website showed the number of people tested. Now it's the number of tests, meaning, somebody could have been tested 2 or 3 times. So are the numbers now accurately reflecting what's happening out in our communities?
Yeah.
And why this change in the reporting of the data?
Well, first of all, they're accurate numbers, and I'm going to let the minister explain it. But you pretty well explained it, Christina. We're testing some people a couple times, maybe a week later, but they should still count as a test, and that all depends on their situation. But I'll pass this over to the minister for you.
Well, in actual fact, this doesn't have a significant impact on the number of tests conducted. We are up to 9,000 tests. The number of people who have been tested more than one time are not significant in terms of the number. What's more important is that we've really expanded, first of all, our capacity to test, and we've expanded the number of people that we're testing, and in different locations, in long-term care homes, frontline healthcare workers, working with Indigenous communities, working with essential service workers. We're expanding that capacity, and that is what relates to the significant increase in the number of tests that are being conducted. And it really brings us more in line with what most of the other provinces are doing and the way that they're reporting, principally British Columbia.
Thank you. I'm wondering if I can ask about something you talked about yesterday, that within 24 hours, long-term care homes in the province would have the PPEs that they need. On the topic of PPEs, do all the long-term care homes in the province at this point, or by the end of the day today, will they have the PPEs that they need? And what about a group home like Participation House that needs PPEs? Thank you.
Well, first of all, the long-term care, even on the weekends, we were able to get it in most cases over within 24 hours. And unless they're not reporting in, which I don't believe they're not doing that, but if they report in, they need PPEs, we're going to have it over there immediately for them. And Participation House, similar situation. We want to make sure that everyone in Participation House and developmental services, they have the proper PPE items that they require as well. So if they don't, my word is please contact us, and we'll make sure that we get the information over. But a very important message, since you've mentioned this, it's absolutely critical that all long-term care, seniors, developmental services, they report into us on their usage, their burn rate per se, until we can start measuring what the usage is out there, and it gives us a better idea on what long-term care needs as a whole, all 626 homes and retirement homes. So it's so important. It is so important that we need to see the usage every single week from these homes and report into us, because that's the only way we can manage it properly, seeing their overall usage.
Next question.
Next question comes from Mark Douglas from 680 News. Please go ahead.
Thank you. Minister Elliott, you mentioned today how the province needs to be ready for a surge of COVID-19 cases, and hence the hospital bed expansion announcement today. I'm wondering, what's the upper limit of hospital capacity? Will there be another bed expansion coming? Will there be more hospitals built? You obviously can't have one bed for every COVID-19 patient in Ontario. So what's the upper limit here for Ontario hospital capacity?
We have been building capacity since the first case of COVID-19 was detected in Ontario, and so we are able to move very quickly to increase the spaces across the province. Some hospitals have chosen to increase capacity by renting hotel space. Grand River Hospital is one that's proposing to do that. Some are proposing to build a more tent hospitals. One has already been created at Joseph Brant Hospital. Others are creating more field hospitals, Winnebago. Some of the other units are doing that. So it differs in different parts of the province. But what we're waiting to see is hotspots that may develop where we need to increase the capacity. We can do that very quickly because we are ready to go. We have the plans in place. We have the teams ready to move in with that. But in addition to the physical capacity, we're also expanding the human resource capacity. That is with the portal that's been open to allow people with experience to come back, retired nurses, medical students are helping us with contact tracing, and others are coming forward helping physicians coming to work into our hospitals. So we are ready. If we see a surge in a particular part of the province, we are ready to move immediately to increase capacity, both in terms of space, but also in terms of human resources.
And then, thank you, Minister. And then just to follow up and just sort of to amend my earlier question where I said you can't have a bed for every COVID-19 patient. It almost sounds like you are, sorry, yes, this is another question for Minister Elliott, please. It almost sounds like you are suggesting that there could be a bed for every COVID-19 patient in Ontario. Is that feasible?
Yes, we are planning for a surge in capacity. We don't want to end up like some other countries have ended up where they've run out of supplies. Ontario is ready. As I said earlier in my remarks, we've planned for the worst case scenario and have planned for that. So we are ready. We have ventilators now for 2,800. We are working with the auto parts manufacturers to build another 10,000 respirators. So we are still building our capacity because we don't know. We haven't hit the peak yet, so our Chief Medical Officer of Health tells us. So we need to continue to be able to plan, to be ready, and to make sure that if we do have a number of patients, a significant increase in patients, that our hospitals will be able to accommodate patients.
Next question.
Next question comes from Travis Danraj from Global News. Please go ahead.
Hi there, Premier. Prime Minister Justin Trudeau said the Quebec government has asked for the federal government to assist with long-term care homes in that province, and Ottawa is looking at the possibility of sending in military help. Has Ontario asked for help from the military, and if so, why not?
Well, we haven't asked as of yet, but everything's on the table. We won't hesitate if we feel that's a requirement from the command table that they need their support. They'll be there. We won't hesitate to ask for support, no matter if it's even contact tracing, as the military has offered. So we won't hesitate to ask for the support if needed.
Okay, my next question is for Minister Fullerton. Dr. David Williams, when asked yesterday, said policies around long-term care facilities are determined by the Ministry of Long-Term Care. You said just now that you are relying on the advice of him. So it seems as though the buck is being passed around from this 1 o'clock news conference to the 3 o'clock news conference with him. Who makes the ultimate call, and why didn't the ministry act faster to implement some of these changes that won't be in place until next Wednesday?
So for the emergency order this time requiring staff to work at only one home, that gradual time over a span of a week was to allow the homes to adapt so that they were not left without staff. And so that was a very, very important consideration. Let me just clarify the role of the Chief Medical Officer of Health and Public Health. They have a very specific job to do. They are the people who work, and I was on the Board of Health for a number of years in Ottawa, so I understand this very well. They act on the scientific information and medical information and the evidence, and they will make recommendations to the ministry. They also issue directives. As a Ministry of Long-Term Care, we have levers in there that are regulatory, and we can adjust those levers. But let me make sure that everyone in Ontario knows how closely we've been working with the Chief Medical Officer of Health and Public Health in a timely way to understand every single measure that we can take, particularly that is science and evidence-based. So I'm pretty sure that you want people who are up to date on all the science and evidence, and the politicians can do their regulatory work, and that's the division.
Next question.
Next question comes from Rob Ferguson from the Toronto Star. Please go ahead.
Hi, Premier. This one's for you. Just in terms of the call later today with the premiers and the Prime Minister, I'm wondering what you're looking for from Justin Trudeau, and especially on nursing homes. What more do you need?
Well, I think it's going to be an open conversation like it usually is, and everyone put their requests in, but I think we need support for our frontline healthcare workers at long-term care on wages. It's very simple. These people are working day in and day out, and they need to have their wages enhanced, in my opinion. So we need their support. We need the federal support, and yes, we'll come to the table as well. But I want to see what the federal government has to offer.
All right, thank you for that. And a quick one for Minister Elliott to follow up. Minister, you were talking earlier about waiting, more capacity for the surge, and the Chief Medical Officer of Health hasn't said we've peaked yet. He did tell us Monday and Tuesday that we could be in for the peak this week. So has that changed?
No, I think we're still waiting to see very carefully what's happening. Because we're doing more testing, we're also seeing more people being diagnosed with COVID-19. So I think the Chief Medical Officer of Health, as well as the people who do the modeling, are waiting to see where this is going to settle out when you take into account the increased level of testing with the increase in the number of cases. So I think we're just in a holding pattern right now, waiting to see which way this will go. Of course, we know that we need support for our long-term care homes right now. That is contributing significantly to the increase, and so we need to build that iron ring around them, which is what Minister Fullerton and her team are doing. And then we'll see where we are with this. But we are still planning for an increase in numbers. I hope we don't need to use them. We don't need those hospital spaces, but they are there if people need them.
Next question.
Next question comes from Randy Rath from CHTV. Please go ahead.
Hi, Randy.
Hi, Premier. Yesterday, President Trump was talking about opening the border with Canada soon. Given the situation in Detroit and in New York State, is that something that worries you? And if he moves to do that, should Premier or Prime Minister Trudeau simply say no?
Yes, he should say no. He should say no right away. We until we have this under containment, we need to keep our borders closed. We need to make sure that at our airports we have the proper people there, at least asking questions, making sure people self-isolate. No, we're the most welcoming country in the world. And if there was one thing that we could have improved on, I'm not being political because I'm a big supporter of what the federal government has done. We should have shut down the borders a lot sooner. We should have put better screening in at the airports, which never happened. And that's not a slight against the federal government. I'm just pointing out, absolutely not. We should not let our closest allies, and we welcome them open arms when things straighten themselves out. But no, the answer is absolutely not. So. That's the answer. Simply not. I don't want them in Ontario. I want to protect our people of Ontario first.
Okay, and my next question is for Minister Elliott. Minister, I asked you last week, the week before, I can't remember, about the situation with pharmacies only dispensing drugs 30 days at a time. Are you going to move soon to help people that are hurt financially by this? And also, India has shut down the export of raw materials that we use to make basic drugs, and the pharmacists say that we could be running into severe shortages by the fall. Have you managed to find alternative supplies of the raw materials that we use to make common drugs?
Well, on your first question with respect to helping people who are now being required to pay 3 dispensing fees because they can only receive their prescriptions in 30-day intervals, yes, we are ready to move on that very quickly. We had some discussions about it yesterday, and we expect to be making that available to the public very soon, because we know that this is a difficulty for a number of people, and something that this is a decision that government made to protect the supply of medication, to make sure that there's enough for everyone, and it is something that we are dealing with. So you can expect something from us very shortly on that issue. Secondly, with respect to the pharmaceutical ingredients for medications, we are following that very closely. We have not received indications of significant problems as yet, but as we're seeking that the medications that people rely on in Ontario will continue to be available to them.
Next question.
Next question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi, Mr. Elliott. I wanted to ask you about the new directive today on stopping transfers from hospitals to long-term care facilities. I'm wondering why that decision was made and how this will impact capacity in hospitals, and whether the expansion that you announced today is in effect to also serve as long-term care facilities in hospitals for people, seeing as what we're seeing happening in the sector now.
Well, the decision was made just because we're seeing the impacts of breakouts in long-term care homes. We know that that's a priority population that we need to protect. We want to make sure that we don't create any more new admissions because they're having difficulties dealing with their current residents. We want to make sure that everyone is going to be safe and healthy, and so those patients will remain in hospital if they need to be in hospital rather than being transferred to a long-term care home. And but it works the other way around as well, of course. If people are in long-term care homes that are very ill and the self-isolation isn't going to be enough, that they need assistance, they may need to be on a ventilator, then of course they will be taken to hospital, and of course they will be cared for in hospital.
Okay, and my follow-up is for Dr. Fullerton. I'm hoping you can clarify the order. It comes into effect next week, but it also says that it is only in effect until April 28th. So is it only in effect for a week? Will Cabinet be extending that? And just on the exemptions as well, I'm wondering why retirement homes weren't included in that. And if you will be testing, if you talk about the asymptomatic spread of this, and we're going to be allowing temp workers and contract workers in to various facilities, will they be required to take a COVID-19 test before starting employment?
So a few questions in there. The first one revolves around the timing of the emergency order. And so emergency orders are typically 2 weeks. Understanding that we needed to give time to the operators of the homes and the staff to make their decisions. Some homes had already begun and had already had this in place, where they were having their employees only work for them. But we recognize that there are risks in enforcing this, where we may have homes that have staffing shortages, and that leads to your next question about the agency personal support workers. We need all workers to have stringent screening when they arrive at the home for work, when they leave. They are screened twice. It is active screening, and anyone who's been in contact with someone who has COVID-19, they will be tested. And asymptomatic contacts of COVID-19 residents or staff would also be tested. So the measures that are being strengthened by the Chief Medical Officer of Health and we're issuing this emergency order to take every measure and every action that we can take to shore up this iron wall. And as I've said before, this is around the globe. Long-term care homes being hit. This is an evolving science and evidence that our Chief Medical Officer of Health is working very hard to make sure that everything is done that can be done, and we're collaborating with him and following his advice.
Last question.
Last question comes from Colin DeMello from CTV News. Please go ahead.
Hi, just a question for the Premier. Premier Ford, it seems like the province really coming into this over-prepared for COVID-19 when it came to hospitals, so we're in good shape, but we've under-prepared when it came to long-term care. Hindsight, as always, is 2020. So if you could go back in time, what would you have done to better prepare long-term care for COVID-19?
Well, it's a good question, Colin. Again, I say this all the time. I'm not the medical professional. I rely on our COVID-19 command table to give us direction. But you could look back in hindsight and say, you know, could have, would have, should have, and imagine if it went the other way. Imagine if our hospitals, and I'm not ruling that out yet, our hospitals were inundated. We've been very, very blessed that the people of Ontario, or the 14.5 million people, listened. They listened, they followed instructions, and that's the reason we're in, again, I say relatively not bad shape. I'll never say good because, again, the peak could happen, you know, tomorrow, the next day, next week. So, you know, we can always look at continuous improvement. That's what we're doing. I'm seeing all areas, no matter if it's long-term care or Ministry of Health or procurement. Everyone is really ramping up, and we're getting better every single day. This is a you know, virus that they didn't have a playbook for anyone in the world to go by. We learned a lot, and we've learned a tremendous amount. And as we're learning, we aren't waiting. We're changing things as we're moving forward. So there's still a lot to be learned, and we're going to continue making the appropriate changes as we see it coming.
Thank you, Premier. I mean, you know, we've still seen you know, hundreds of people die in long-term care homes. Many more are sick. Of all the measures you've taken to date when it comes to long-term care homes, do you feel like if you've taken one of those measures earlier, that maybe we could have saved more lives and it would have been more effective? We wouldn't have been in this position right now. Any one of the measures that you've taken so far with long-term care homes, could one of them have been implemented sooner and have saved lives?
No, I can't. You know, I don't like playing the armchair quarterback. We could have done something. Again, I listen to our medical professionals, follow their advice, and I will always listen to their advice based on health and science. And that goes for everything moving forward, even opening up the economy. This is all based on health and science, and I won't waver. When I get the green light to move forward on something, I get it from the medical professionals. And once we get up and moving forward, when that time comes, that's what I understand. I understand the economy, I understand numbers, and we'll be going full steam ahead when that time comes. Once we get approval from our medical professionals, the chief medical officer, and not just one, right across the board. I believe there's 34 chief medical officers in Ontario. We need a consensus by everyone. We aren't going to rush into this moving forward on the economy. Health is more important than anything right now, absolutely anything. But thank you, Colin.
Thank you.
Thank you, everyone.